I'm Stephanie Frisch, Director of Nursing at Vital, where we make AI-powered patient experience software. Today, I have the pleasure of speaking with Dr. Lisiane Pruinelli, Associate Professor and Clinical Informaticist and Researcher at the University of Florida College of Nursing and College of Medicine. Among her many interests is artificial intelligence, or AI, so I'm particularly excited to speak with her today. Welcome, Dr. Pruinelli.
Thank you. It's great to be here.
So tell me a little bit about your role is associate professor and clinical medicine and researcher. So tell me a little bit about kind of just you.
Most of my time is in research. I do research mostly in complex conditions like transplantation. That is my main area. And in that area, basically, I develop new models that can improve patient care. And those models are machine learning, artificial intelligence-based models, specifically focused on the discovery of how conditions progress over time and how can we early on identify how to prevent or to delay the progression of such conditions. So that is my main area here. I have several other roles in service that I think I will talk a little bit more later on, linked to artificial intelligence in nursing.
Perfect. I love it. Sounds like you have a lot going on. We can't wait to dive in. So one thing I wanted to talk to you about, how do you see nurses getting involved earlier in the process for evaluating technology before it's implemented? And then what would you think the benefits are of doing so?
I think that I have to remember that I also was a clinical nurse before joining the academia. So I work a lot in acute settings, ED, ICU, in direct patient care. So I have that understanding now when I try to foster knowledge for nurses, right? One of my main work nowadays related to this question that you just raised is linked to the NAO Collab. So the NAO Collab is an initiative that we started in 2019, and we try to foster awareness for nurses in how to use technology and how can you build this knowledge that nurses can feel comfortable and request their place on the table to actually participate of the life cycle of the technology development. We believe that if nurses don't do that, it's hard to understand later on how to use that technology. So we want to make nurses to participate more on the early stage of these technologies, as well as to bring what are the problems that they have on every day that actually technology or AI or machine learning can actually help them to solve. And that is linked to this work and how can we have a better set of policies that can protect and help nurses in that direction, or how can we build more resources that nurses can use to understand better that process.
That's great. How early do you think you would suggest getting involved? Like, are you talking when we're in nursing school and really to understand that processes?
Yes, I think yes, not just on the learning, right? But also the educators will need to be prepared to teach those new nurses on that direction. If they have that already built on their program, when they go to practice, they will already know the process and how to speak out for themselves and know this is the opportunity that we need to take over, or this is an opportunity that we need to take to improve. And they know the process of how to do that or where to go to get that solution.
Exactly. That's great. You mentioned policy. So, what do you think the future holds kind of for that policy piece for us?
Yeah, I think in the last couple of years, there were several improvements in that policy, particularly the NAO Collab group We have been invited to provide feedback, for example, to the American Nurse Association policy on artificial intelligence. We also help the International Council of Nurses to build their own artificial intelligence policy statement. And how can we make sure that these words or how can we protect nurses inside these policy statements are key, because we need to make sure that we have that covered in one way or another in that policy level for them then to be implemented, and making sure that we have our nurses feeling comfortable, feeling protected when they are caring for patients using technology.
That's great. Thank you for being part of that initiative. It sounds amazing.
Thank you.
One thing that's a great transition, right? So we know that this has progressed more over the last couple of years. It's gotten more interest. I feel like nurses now are really kind of pushing to be at the heart of these conversations. And I think you and I are a little biased, but I can say I think it's really important to have nurses at the table, especially when we're the ones that potentially could benefit the most from all of these advances in technology, even in the last year, with the introduction of generative AI. So really, I would love to hear your thoughts on what do you think AI will make the most impact in nurses, maybe in like the next year or two?
I believe that, I think that is where I push, right, is to make use of technology to release nurses from mundane tasks, the heavy lift tasks. Because I think we have a science, we learn how to build it very critical decision making, how to advocate for patients, but we are still spending a lot of time in tasking. And those tasks can be very easily solved by technology, and we have that. And along with that, we also will help nurses to have a more pleasant job, how they can enjoy more, feel that the job is more rewarding, right? Not have so much back pain. I remember on that time that we used to have, like I used to have back pain because of the heavy lift of tasks that I used to do. So I think that is where I think we should push to have technology to help us, and that will increase nurses as a science, nursing science as a whole.
I couldn't agree with you more. It's one of those things where we need to take that and make it to the next level and use technology to our advantage, and make sure it's matching our clinical workflow, and it's used to make sure maybe we get a little bit back to the heart of what we all love to do, which is take our nursing knowledge and exactly like you said, be an advocate for those patients, and make sure that we're able to have that time to do that.
Yes, exactly.
So we know maybe artificial intelligence might be a little hard to understand if you don't know much about it. What do you think, as a profession as a whole, what do you think is going to be the most helpful for nurses as a profession to get AI more incorporated with our care every day?
I am a great believer on education, in how can we educate ourselves or our peers, or how to provide educational tools to foster something that we don't know, right? Because if I don't know something I'm scared about, I want to learn about. So how can we build more resources that nurses feel more comfortable in talking, in reading, in using technology, right? So I believe that that is the step to go to get more knowledge. But to get more knowledge, we need to build more educational resources that are tailored to nurses, based on what they do, not on something else or another profession, right? We have to understand the nursing care and the nursing practice to actually build these resources that can help them in that specific situation.
Right. So do you think it's multimodal, we think, so early on, but it's training when you're actually in these acute care settings, I think is important. What do you think about that?
Yeah, I think it's a continuous training education, because technology is changing. Like what I knew last year I don't know anymore, right? Because things progress so fast. So I think that would be a little bit tricky, maybe can we create a constant learning? And I think that comes with what we have been discussing a lot lately in the learning health system. And I think that is also incorporated to our practice, not just how we will deliver care, but how we will practice care, right? And how this constant learning will keep recycling over and over again, but needs to be something natural, right? Doesn't cannot be something that you need to do. Should be something that is enjoyable, that people can have that as a fun thing to do, right? Then I think would be easily incorporated in their daily practice.
Yeah, I couldn't agree with you more. I think, right, so we're lifelong learners. We know the importance of knowing everything that's up to date for our patients, and that just continue on for our whole life. And now that artificial intelligence is one of the things that honestly I think is going to help us, like you said, with those maybe those mundane tasks that might not need to fall on nurses anymore.
Yes, correct. We even talk in a couple of um, positions that we made in publications that we made. We want to make nurses talk on the top of their license, right? And I think that is where we want to go. And there are different ways that we can build that progression, but that is where we want to see nursing going, right?
So that's a great transition into, I know that one of our concerns just in general as a nurse is the patient understanding what we're telling them. So really health literacy is a concern just in general, like throughout the globe, honestly. So do you think maybe artificial intelligence might be able to help with this?
Yes, I think yes. I think first we need to understand very well this technology, right? Because I think that I co-chair another working group that calls data science and clinical analytics, and we have been discussing a lot, not just health literacy, but going a little bit deeper into data data science literacy. So because I think when we move to technology, when we move to artificial intelligence, dashboards, all these smart solutions that we have now, we kind of go a little bit deeper into this health literacy. So once nurses need to advocate, or they should, or they like to advocate for patients, and patients rely on them a lot, we need to make sure that nurses understand what it is. And that is data or data science literacy, not just health literacy, but how those pieces of that technology make sense together, right? What are those pieces that they need to understand? And that come back to what we were talking earlier about knowledge, right? But how can I explain to someone if I don't understand, right? That specific. So I think that is something that will grow a lot in the next year, because there are a couple of task force working on that. I know that HIMSS is doing something related to that, and my working group as well is doing something. So the plan is that by the end of this year, next 6 months, like the academic year, we can deliver kind of like a tool set of kind of what are the key data literacy concepts that we can leverage for different levels of nurses, right? Because the bedside nurse will need to know something, but the leader will need to know something, right? How the educator differs, or a researcher, or someone that is working quality improvement. So there are different layers there, and everyone will need to know different pieces that are more tailored to their job, to their work, and how that is related to the patient.
That's great. Right. I think it all stems from having the tools in your toolbox to be able to do everything you need to do. And it's exactly right. I cannot wait to see what your groups come up with. I think it's essential moving forward. What do you think is next? Like once we have those resources, I mean, how do we decide what we use in nursing?
I think it will be based on the need and the problem that we want to solve or we have, right? And I think that will feed back to how do I get more information about that, right? Let's suppose the tools set, or there is a concept that is very important, right? do we have educational resources to actually educate, instrument to make available for nurses to use that specific concept? So I think every piece of that will kind of start exploring, right, to different sets based on needs. But for sure, I believe should be based on the nurses' need when they are practicing. And I think that will direct back to what other people are doing and how can we help them in this feedback, right?
Great. Okay, so we talked a little bit about kind of like the mundane tasks, but can you think just off the top of your head? I'm putting you on the spot here. I apologize. So, are there things do you think that we can use artificial intelligence to automate that we do as nurses?
I can go in different directions there, right? I can go very simple that we don't need a big algorithm to do that. We just need kind of heavy machine, let's suppose, lift patients, right? How can you automatize lift patients or carry patients around, right? Move patients from the bed to the chair, right? That is a very simple task, that a technology, a tool can help to do that. And you know, you can just supervise, nurses can just do their supervision on that. We don't need to actually leave the patient. Then I can go a little bit more into a more complex solution that maybe will help nurses to better annotate, right? Like we spend a lot of time with documentation. Documentation is still a problem. It's hard to have good quality data that comes from this documentation. But how artificial intelligence can help that? I think a good example is like, for example, addressing. When you change address, you try to picture in your mind that scar, and then you try to memorize to reflect that picture into words, right? Why not can we build a smart solution where while we are changing the dress, we can maybe take a picture of that and maybe point some small notes about, oh, I want to take a note here because I should see how this is tomorrow, right? And translate directly to the EHR, right? Then can be linked to the words that we are describing. So I think there are different layers from simple solutions to mid to like more like complex solutions. But that is feasible because that is done outside the healthcare, right? How can we actually bring these tools to the nursing world? And I think that is where, when you were talking about conferences, it's meeting, but how can we actually bring the nurses to talk with these builders, right? How can we help them to navigate that interaction? Because I think that is that interaction is what will make these solutions happen.
What do you think about one more thing? What about predictive analytics? Do you think potentially there could be some help there with nurses?
Totally. That is, you let me know when I should stop talking, because that is actually my field, is predictive analytics. And I think there is a lot of room for predictive analytics. The work group, the data science and clinical analytics, the main goal is to foster predictive analytics and predictive analytics skills for nurses to solve nurses' problem. But I always say that predict is easy, right? But how can we actually prevent what you are predicting, right? I want nurses to do that. We can predict falls, but how can you predict who will fall in time that they will not fall anymore, right? That is where we want. And that process will help a lot to improve nursing care, and decrease cost, make patients have better quality of life, that they don't stay longer in the hospital, right? Or don't deteriorate. Yes, predictive analytics, there is a lot of room there. We have to use more, but I want to go a little bit further in that predictive analytics, where we just don't predict, but we also help to not happen, right? We address those risk factors early on that will not happen the outcome that we were predicting.
I couldn't agree more. Well, Dr. Pruinelli, I am so excited for everything to come for artificial intelligent nursing. And thank you so much to our audience. To learn more about Vital's patient experience platform, please visit vital.io. Until next time, thanks everyone for everything that they do out there to make patients and clinicians' lives easier. We'll see you all
Thank
next
you.
time.
Thank you.